Sleep disorders, causes and solutions according to the latest studies. Sleep disorders are a common problem that affects millions of people around the world. Not getting enough sleep can lead to many health problems like poor focus, mood swings, and a higher risk of heart disease and diabetes. In this video, we'll give a detailed explanation of the causes of sleep disorders and the best solutions according to recent studies. First, what are sleep disorders? Sleep disorders are a group of conditions that affect a person's ability to sleep normally. They can include insomnia, interrupted sleep, excessive sleep, and sleep apnea. The cause may be linked to psychological factors, environmental factors, or other health problems. Second, the main causes of sleep disorders. First, psychological and mental factors. Anxiety and depression are among the most important reasons that lead to difficulty sleeping. When you feel stressed, your body releases the hormone cortisol, which leads to increased nerve activity and makes it hard to relax and fall into a deep sleep. According to a study published in the journal Sleep Medicine, more than 50% of people with insomnia suffer from psychological disorders like anxiety or depression. Second, environmental factors. The surrounding environment greatly affects sleep quality. One of the most prominent environmental factors that cause sleep disorders is the blue light emitted from screens, which reduces the production of the hormone melatonin, which regulates the sleep-wake cycle. Noise, even simple sounds like traffic or household appliances, can affect deep sleep. Temperature. A very hot or cold room affects sleep comfort. Third, unhealthy habits. Consuming caffeine and nicotine. Caffeine is a stimulant that stays in the body for hours, making it difficult to sleep if consumed in the evening. Irregular sleep. Constantly changing sleep and wake times can disrupt the body's natural clock, affecting sleep quality. Eating right before bed. Eating heavy meals before bed can cause heartburn and indigestion, leading to interrupted sleep. Fourth, health problems. There are many health conditions that can lead to sleep disorders such as sleep apnea. This happens when a person stops breathing for several seconds during sleep due to a blocked airway. Restless leg syndrome. An overwhelming urge to move the legs during sleep, causing frequent awakenings. Thyroid disorders. An overactive thyroid leads to insomnia, while an underactive thyroid can cause excessive sleepiness. Third, the latest solutions according to recent studies. First, adjusting daily habits to improve sleep quality. Set a regular sleep and wake time every day, even on weekends. This helps the body regulate its natural clock. Avoid caffeine after noon, as the body needs about 6 to 8 hours to get rid of it completely. Exercise regularly, but it's best not to exercise right before bed. Second, cognitive behavioral therapy for insomnia, CBTI. Cognitive behavioral therapy, CBTI, is one of the most effective ways to treat chronic insomnia. This therapy focuses on changing negative thoughts about sleep, improving sleep habits, like reducing the time spent in bed without sleeping, and relaxation techniques like meditation and breathing exercises. A study published in the Journal of Clinical Sleep Medicine showed that 70 to 80% of people who underwent CBTI saw an improvement in their sleep quality. Third, exposure to natural light in the morning. Exposure to sunlight in the morning helps regulate melatonin secretion, which leads to an improved sleep-wake cycle. Doctors recommend getting 20 to 30 minutes of sun exposure every day in the morning. Fourth, using smart technology to improve sleep. There are advanced apps and devices that help track and analyze sleep patterns, such as smartwatches that measure sleep quality and offer tips for improvement. White noise machines help reduce the impact of outside noise and promote deep sleep. Fifth, treatment with medications and dietary supplements. Melatonin is a dietary supplement used to improve sleep, but it should be taken under medical supervision. Sleeping pills are prescribed in some severe cases, but they are not recommended for long-term use due to the possibility of addiction. Fourth, when should you see a doctor? If you experience the following symptoms, you may need to consult a doctor specializing in sleep disorders. Difficulty sleeping for several consecutive weeks. Waking up repeatedly during the night for no apparent reason. Feeling tired and exhausted despite getting enough hours of sleep. Feeling choked or stopping breathing